Do you have any pain, aches, or any neurological condition? And you're wondering, like, can you do anything or exercise at home to help you with the recovery? Yes, you can. My name is Johnson, a registered physiotherapist, and my model is Aldina. We will show you a series of exercises that you can perform at home on your own or by the help of a caregiver. Aldina, let's go! Back pain is a common health condition that affects a lot of people due to occupation. It might be sports injury, posture, and various factors. But we want to show you the things that you can do to help you relieve the pain or reduce the pain and also strengthen the back. So the first exercise we're going to do is called back extension. So back extension, you just lie down, then you stretch your back to the limit of pain, like 5 times. Do it 1, 2, up to 5. You lie flat, lie there. Then your hands on the side, like that. Then you lift your upper back 5 times. Then up. Good. Let it to be more natural, okay? Just like get a rhythm, like baby press ups, okay? 5 times. 1. Good. That's better. 2. Good. 3. Nice. 4. Nice. 5. The next exercise I want you to do is called the cat and cow. It's in the same position, but now you'll be on your forelegs this way. This. Then you try and move your lower back up and upper back, okay? You interchange. You do it 10 times, okay?
2, 9, 3, 2, 4, 9, 5, good, up to 10. 6,
This is meant to stretch the lower back. It's called the quadratus lumborum, okay? All you do is just bend, then try and stretch backward. It's a very nice stretch for the lower back. This. Then you hold for 15 seconds, okay? Nice. 15 seconds. Nice. Good work. Next exercise we're going to do is going to be relaxing because you're going to be in a lying position. Okay? Just lie facing up. Good. So sometimes when you have a back pain, you'll find that there's a compression on the sciatic nerve around the gluteal region. So the next exercise we're going to do is called the gluteal stretch. Okay? You bend both knees. Good. Then place your leg this way. Then you pull this leg. You'll get a stretch on the opposite side. Then you hold for 10 seconds, okay? Pull as far as you can. Can you feel a stretch? Is it comfortable? Good. Then you hold. Nice. Then you change the other side. Nice, good work. The next exercise we're going to do is called the hook line in the same position, hook line rotation. Hook line rotation is very simple. This is just to try and relieve pressure on the pelvic region and the lower back, okay? Just make sure that your feet are facing up and just move side by side, okay? You do it 10 times, okay? 1, good. 2, nice. Good work. Then you try and breathe in and out. Try and relax, okay? 4, 5, 6, 7, 8, 9, 10. Good work. You can relax. Try and breathe in and out. Deep breathing. Now relax, just in a neutral position. Good. Good stuff. The next exercise we're going to do is called knee to chest. You'll start with 1, then 2, but I'll show you. Just bend one knee, then you try and pull it towards your chest, like that, and hold for 10 seconds. Okay? Good. Is it comfortable?
Yes.
Then you change. And good. Then the next thing you're going to do, now you're going to do both. You try and pull it towards your chest 10 times, okay? There, then you try and pull, good, 1. Then you relax. Nice. Now you don't leave, you have to hold it. Then you just try that way, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good work. The next exercise is going to be very simple, called a pelvic tilt. You just lie on your tummy like that. Then you try and move your hips down and up, just in that position, okay? To relieve pressure on the lower back. Good. 1, nice. 2, do it 10 times. 3, 4, 5, 6, 7, 8, 9, 10. Good work. The next exercise we're going to do is called the hamstring stretch. Why are you going to stretch the hamstring? This is because the sciatic nerve runs from the lower back to the heel. So sometimes you might find that the muscles are tight, they are pressing the nerve. Okay, so you need to stretch the entire muscles of the back region. Okay, so it's simple. You just lift your leg up, then you try and stretch it. You do it 5 times. Okay, gentle, up and down. And one thing you have to note is, like, if you do any exercise and the pain is increasing, you stop it. You move to the next one. Okay. Nice. Take it all the way up so that you get that stretch. Okay. 3, 4, 5, 6, 7, 8, 9, 10. Good, then you change. Then you have to drop your legs slowly so that you don't trigger something, okay? 1, 2, good. 3, 4, 5, 6, 7, 8, 9, 10. Good work. The next exercise we're going to do is a spinal stretch. You know, the spine is S-shaped. For you to stretch the spine, the head and the legs should face different sides. So you just try and place this leg here, then the head should face the opposite direction. Then you just hold, stick in that position for 15 seconds. Then when you're in that position, you try and breathe in and out. Change. Good. Nice. The next exercise we're going to do is the bridge. You just lift your hips up, 7 seconds up, try and lift your hips up. Good. And down, Do it 5 times, 2. It has to be slow, okay? 3. 4. Good. One more. Good work. The next exercise you're going to do it in a sitting position. It's called seated spinal twist. Very easy. Just stretch one of your legs. This one should come here. This one goes here. Then you face the side where your hand is. Okay, you'll feel a very nice stretch, especially the upper back. Okay. That's perfect, but your head should be, try and take your head a bit further so that you get a maximum stretch, okay? You hold it for 10 seconds. Good, then you change. Good. Nice. The last exercise we're going to do is called the knee lunge. This will help to stretch the hip flexors, okay? So it's very simple. You kneel this way. Then you try and push your hip forward. When you feel a stretch, you hold it in that position for 15 seconds. Then you change. Okay. There. Then you try and push, then hold in that position. Nice. Perfect. Then you change. Good. So these are some of the exercises that you can do to help you deal with back pain. You don't have to do all of them. That is something important to note. You can just do the ones that work for you. See? And if you do any exercise and the pain increases, you don't have to continue that exercise. You can move to the next one. The other aspect that you need to understand is that you don't have to do them on the mat. You can do them on the bed. You can do them in the garden or anywhere where you are comfortable. And what is of importance is consistency. You need to do it like 3 or 4 times a day for you to get recovery or good improvement. Thank you very much. We wish you well on your road to recovery.